Every cell in our bodies has a sex.
Yet there's a long and storied history of ignoring sex differences when it comes to health research across the lifespan.
The facts are staggering.
Heart disease kills more women every year than the next 7 causes of death for women combined.
In fact, 25% of female deaths are due to heart disease.
And yet, as recently as 2010, 3 out of 4 heart failure trials did not include women as participants.
Over 420 million people globally have been diagnosed with diabetes.
Approximately 90% have type 2 diabetes.
With the increase in rates of obesity in children, type 2 diabetes,
Historically an adult disease,
is rising among children and adolescents.
Approximately 2 out of 3 youth diagnosed with type 2 diabetes are girls.
the total cost of diagnosed diabetes in the US is estimated to be $245 billion per year.
That's billion, with a B.
The World Health Organization states that there is no health without mental health.
About twice as many women as men experience depression.
Poor mental health is a risk factor for chronic physical conditions like cardiovascular disease and diabetes.
This must change.
And there's an organization helping to lead that change.
The Center for Women's Health Research has always included women in studies.
The CWHR is also committed to understanding how men and women respond differently to medical treatments.
There are over 60 Center for Women's Health Research funded scientists who are addressing these gaps in knowledge.
Through their work, women's health research is catching up.
We know more about sex differences in cardiovascular disease and type 2 diabetes.
Hormones and the relationship to cardiovascular disease and type 2 diabetes.
The importance of considering the interaction between physical health and mental health.
The processes that increase infants and children's risk for obesity and type 2 diabetes.
We are applying our findings by carrying out early interventions for children at risk of developing type 2 diabetes,
Strategies to remove barriers to exercise.
Personalized therapies to mitigate the risk of developing cardiovascular disease and diabetes.
But we have much more to do in mentoring and supporting the next generation of researchers.
And educating the public and healthcare providers about our groundbreaking research.
And our collective efforts will see even more success over time.
You can help too.
Go to cwhr.org, follow us on Facebook, and learn more about our work.
And most importantly, share this video.
So that others can learn more about these discrepancies in research.
You can do that, can't you?
Do it for me.
And me.
And me.
And me.
And all of us.